Greetings to you all. Thank you so much for joining us. And I would like to also thank our moderators, Amos Adelowo and Pete Dion. Not forgetting the International Urogynecology Association for inviting me. So today we're going to unpack in order to understand prolapse, more especially in our African setting, to understand what actually comes down and why. So my name is Dr. Dakaro Muavha. I'm the head of Urogynecology unit in University of Limpopo, which is situated in Limpopo province in the northern part of South Africa, better known by all as Africa's Eden. So in this presentation, we will go through some definition and then we explore the three compartments of prolapse and their content. We then go and explain why pelvic organ prolapse occurs. Then we will review what we know about risk factors of pelvic organ prolapse. Before we conclude, we will have a take-home message. So let's begin. Prolapse comes from the Latin word prolapsus, which actually means to fall. So the definition of pelvic organ prolapse is the falling or the dropping or the herniation of pelvic organs. Pelvic organs referring to the bladder, the uterus, or the rectum. These pelvic organs, they fall into or beyond the vaginal wall. The first picture here, it shows pelvic organs in their natural or normal position. Whereas the second picture shows pelvic organ prolapse, in this case the uterus, which has actually fallen far beyond the vaginal wall and is protruding out of the vagina. The million-dollar question still remains: what actually comes down? So the vaginal wall has actually divided the pelvic organs into three compartments. The first compartment is the anterior compartment, represented there in green. And that's where the bladder is located. The second compartment is the middle compartment, which is represented in yellow, and that's where the uterus is situated. And in a case of a person who had previous hysterectomy, the vault will be in that position. The third compartment is the posterior compartment, where the rectum is situated. So if there's a herniation or there's a bulge in the posterior compartment, the most likely thing which is protruding will be the rectum, and we'll call it rectocele. But it can still be something else. It can be the intestines, which we call the enterocele. In the middle compartment, the most likely thing which will be protruding will be the uterus or the vault in a person who had hysterectomy. In the anterior compartment, then it will be the bladder, and which we call a cystocele. So it can still be something else, which is the enterocele, of course. So this helps us to be able to identify most likely what is protruding based on where the prolapse is actually located. So to understand why pelvic organs prolapse, let's quickly talk about what keeps these pelvic organs together. What is supporting these pelvic organs? So the pelvic support is coming mostly from two main supportive structures. The first one is represented here on the first picture, which is the endopelvic connective tissue, which has several components. The first one is the uterosacral ligaments, the two uterosacral ligaments here, the two cardinal ligaments, and the two pubocervical ligaments. The second part, the second supportive structure, is the pelvic diaphragm, which also has several components, which has the levator ani muscles, it has the coccygeus muscles, and the piriformis muscle. So these two structures are mainly the one which is keeping the pelvic organs together. So pelvic organ prolapse occurs as a result of these supportive structures getting weak. And the weakness of these supportive structures can occur because of multiple factors. And in these slides, we have the main reason of this weakening of these supportive structures. We can start with one. Issues related to pregnancy. When we know that when someone has pregnancy, end up delivering normal vaginal delivery, as a result, there can be tear of this connective tissue and the pelvic diaphragm and the muscles of the pelvic diaphragm. That can weaken this connective tissue and predispose someone from having pelvic organ prolapse. Other than pregnancy-related issues, we have aging. When women are getting older and older with less estrogen, as a result, there is connective tissue weakness or collagen weakness. And that as well has been shown to increase the risk of pelvic organ prolapse. The other risk factors is when a patient had previous pelvic surgery, such as hysterectomy. We know when we do hysterectomies, we cut those uterosacral ligaments, and that can result in weakness and predispose patients from having pelvic organ prolapse. The same applies with obesity and increased intra-abdominal pressure. Those exert a lot of pressure in those supportive tissue, and with long term they become very weak and predispose these patients from having pelvic organ prolapse. Same applies as issues related to menopause, where because of low estrogen there will be collagen weakening and predisposing patients from having pelvic organ prolapse. So with all those risk factors or main risk factors, someone can tell me, why, Dr. Muavha, why is this pelvic organ prolapse occurring mainly in Caucasian women? Because the risk factors, the main risk factors which you just explained now, are not synonymous with Caucasian women. So if these risk factors are not only found in Caucasian women, why is this pelvic organ prolapse occurring in Caucasian women than the other women, especially African women? Let's go and see why. So somebody will ask, is it because more Caucasian women are obese more than African women? Let's dive in a situation in one of the African countries, which is South Africa. The Stats SA has shown that 26% of South Africans are obese, and that South Africa is actually ranked number 14 in the whole world when it comes to obesity. And the demographics there shows that actually more black women are obese more than white women. So which means The reason why Caucasian women are having pelvic organ prolapse more than black women is not because of issues related to obesity. What could it be? Let's see. Maybe black women are actually couch potatoes. Because, of course, there's a meta-analysis in front of us which has shown that 36% prevalence of pelvic floor disorders in female athletes in different sports when compared with sedentary women. But, who is measuring the weight of a lady who is carrying firewood from the mountain or carrying water on the head from the river to the home, or who is working in a farm? At least the ones who are athletes, you can tell that they have been lifting 20 kg, but how would you tell with the second picture of the lady who is lifting this firewood? So, and how many of the white women who are generally in the population who looks like this lady? So, if that is not the cause of the pelvic organ prolapse in Caucasian women, what could it be, Dr. Muavha? Let's go further and see. Or no, maybe because it has something to do with pregnancy. Maybe it's because of how Caucasian women delivers and how black women delivers. Or maybe Caucasian women more likely to have more children than black women. Or maybe it's just the setting on where black women delivers and the setting where white women delivers. Let's look, let's go back. I'm going to take you back to my familiar territory. The first picture you see here is the picture of a lady in Latin face in Cape Town, where she's actually having a doula, and she came very early at 2 centimeters, and she's having a one delivery room on her own. There is a CTG monitoring nearby, and also a doula as well, taking care of her up until she goes and delivers. The second picture is a labor ward in Malawi, where if you get a bed of delivery is when you are close to 9 to 10 centimeters, when you are almost about to push. Otherwise, you don't deserve a bed because there's not enough beds. Meaning, in the second picture, the monitoring of labor, the issues related with complications associated with pushing early and perineal tears, we can obviously say in such settings, the risk of tears and the risk of complications related to pregnancy might be a little bit more compared to the setting where you just have a doula, one labor ward, and CTG monitoring and all those. And we know without any kind of shame that in an African setting, majority of African countries and African hospitals, the care and the monitoring is not as good, is substandard. And it's not because the doctors are not good, but it's just because the facilities are not geared enough to be able to accommodate all this. So it can be that maybe black women are somehow protected with the risk factors related to pregnancy issues. As a result, the reason why Caucasian women are having pelvic organ prolapse is not because of pregnancy-related complications which occurs in Caucasian women more than in black women. So, if that's not the case, so what is it? Oh, I see your excitement in your eyes. You say you got it now. White women live longer than black women, of course. That was the reason all along. But hold on a minute. Which age are you referring to? Is the age in the person's ID book or her real age? If you go to a small village, Kamwashinyamani, or in Kandengeza, you'll find that there is an old woman who is younger than her firstborn from her ID book. And this is coming from the time during apartheid, where people will be given their age when they go to Home Affairs to do their dom pass. And they will be just given an age based on when they estimate they were born. Someone will say, I was born during the flooding in Mozambique, or I was born during when the time there was famine. And they just estimate, oh, you possibly were born in 1822. You know? So this age and this issues of patients dying younger when they are black, it's difficult to swallow when I go to my village where I work and I realize that there are very old people who are given their age too low because they didn't know when they were born, of course because they didn't go to school. And of course the apartheid government required them to have a dom pass and they had to pick any age which came to their mind. So what are we comparing? Apples and donkeys? You know, it's difficult to say that is the reason why women, Caucasian women, are actually the one who are getting pelvic organ prolapse because they live longer. Comparing to what? If you don't believe me, let's see the studies which were done in Africa. I hope you are now convinced that the risk factors of pelvic organ prolapse is not synonymous to a Caucasian woman. It's not exclusively found in white patients. But don't just take Dr. Muavha's word for it. There was a study done in Tanzania on the prevalence of pelvic organ prolapse. So the study, they looked at women between the age of 18 and 90 years. And they went to do a home-based interviews in the language the patients understands. And they later called these patients to the clinic for an examination. What did they find? They found at least they had 1,047 women who came for an examination after the interview. And out of those 1,047 women, they found that 64.6% of these women had anatomical prolapse, grade 2 to grade 4. And they further found that there was 6.7% of these patients had severe prolapse. What was the common risk factors of these patients? It was not because they were Caucasian. It was that majority of them were age above 35. They were farm workers. And they had 3 or more children. Let's see another study which was done in Cape Town. Even though this study, which was done in Western Cape, in Cape Town, was only looking at the daily urinary incontinence, it is part of the pelvic floor disorders. Contrary to popular belief, they actually found more daily urinary incontinence in black women compared to white women. They found that 17.2% of those women who were studied had daily urinary incontinence. And 12.8% of those women were Cape Coloreds, and only 13.2% were white women. So what does it mean? Knowing what is written in your medical books about the prevalence of pelvic floor disorders in black women and in white women. Let's look at what this information is actually coming from. Because of time, I have just pulled 2 studies which has compared white women and black women when it comes to pelvic organ prolapse. And there are many of those studies which finding its way in medical books in Africa. Let's see the first study. Here the first study, they were checking the difference between pelvic organ prolapse with different races. And the conclusion was, compared with African American, white women had 4 to 5 times higher risk of symptomatic pelvic organ prolapse, and white women had 1.4-fold higher risk of objective prolapse. That's not the only study. There's another study here. The second one here, they were comparing the risk factors for developing prolapse between whites, blacks, and Hispanic. They found that white women are at risk for developing grade 2 and 3 pelvic organ prolapse compared to blacks. I'm not going to say anything about these studies, but I want to give you an example. This is the study done in South Africa about obesity, where only 9.6% of the populations are white. The question is, why are countries like Ireland are not adopting this study in their textbook when they're teaching medical students about obesity and prevalence of obesity among white people? But why are we taking studies about black patients which are done in America and which are done in areas where actually the population of black people is much lesser than what we see in Africa? And we adopt it in our medical school and teach our medical students about the prevalence of pelvic organ prolapse in women or in black women, basing all this on studies like the previous 2 which I have described. This is just a question. Almost done. Take home message. All main risk factors of pelvic organ prolapse are also present in black women. It is also true that few reported incidents of pelvic organ prolapse in black women is because they are black. It's not because their tissue is much more tougher against all risk factors and against all odds compared to other ethnic groups. This is because black women are underprivileged even in underprivileged society. This, coupled with cultural norms and lack of urogynecology service where they stay, result in underreporting of pelvic organ prolapse in these black women. So it is all in our hands as health workers from Africa to equip ourselves with knowledge on pelvic organ prolapse and pelvic floor disorders, so that we can able to equip these black women whom we are so privileged to serve. It is also true that airports are not filled with people who are coming in from outside in Africa to come and save all these black women from pelvic organ prolapse. So it is all in our hands. It is all in our hands. Thank you so much. Goodbye.